Hello, doctor. Once again, I welcome you to the MIT series, like most important series, video number 2. Guys, hope first video you liked, and I have explained in detail about radiology, what topic you should study. So again, going forward, today I'm going to explain you the second videos, and the subject will be ENT. Guys, let me explain you overview about ENT. Like ENT, from ENT you are going to have 12 to 14 questions, minimum 12, maximum 14 to 15 questions. But guys, one thing I want to say, why I have reviewing on the second videos, because ये जो 12 मार्क्स होते हैं ना और 14, ये अचीवेबल होते हैं. You can achieve this 12 marks or 14 marks in, like, if you will go through in detail in this subject, you are going to have your 14 marks in your like exam. So guys, without wasting time, let's start the subject. As I explain you, अगर तुम अच्छे से पढ़ोगे तो 14 मार्क्स तुम्हारा होगा. ये हम मेडिसिन में प्रेडिक्ट नहीं कर सकते. वी कान प्रेडिक्ट इन मेडिसिन, वी कान प्रेडिक्ट इन लाइक पेडियाट्रिक्स that how many question is going to come, but for ENT sure there will be 14 to 15 questions, and all questions you can get correct marks in your exam. Why I'm saying with experience? Because last 2 exam continuously I have scored 14 out of 14 in ENT. So I can say my favorite subject, ENT is one of my favorite subject. So for that I'm going to explain you what topic you should study in detail. So guys, let me come on the source. कहाँ से पढ़ना चाहिए? Source, I'll tell you that you should like whatever you have, जहाँ से भी तुम पढ़ो, whatever coaching you are following, do follow that notes. वही notes पढ़ो जो आज तक पढ़ता है. जो स्टार्ट नहीं किया है या जो अभी स्टार्ट करना चाह रहा है, फॉर देम माई सजेशन विल बी आइदर माई फर्स्ट सजेशन विल बी स्टडी विथ डॉक्टर राजीव धवन सर. Currently he teaching in, I think, MIST, and also he is having separate app. It's, I think, about 2 to 3,000 cost for that application. You can buy subscription for 3 months, only one subject, or you can anywhere you can get his notes, like Nikki Point. If you are in Gautam Nagar, Nikki Point, various shop you will be able to get his notes. I think it's of 120 pages notes. Secondly, like in various coaching also one teacher is there, Agarwal sir. So you can go through his note also, or you can study with him also. So this is my overview, what source you should follow. Now I'm going to explain you the topic. Guys, there will be different obviously in ENT there is 3 category. So each I can say ear, throat and nose. So I'm going to explain you separately what topic you should study in ear, what topic you should study in throat and nose. So sorry, let's first start with ear. Guys, in ear there are many diseases, tumors and some other parts important, in which you are going to have questions for definitely. And also image base are there from ear, nose and throat also. Like this subject also there will be 2 to 3 images there. So let's start with ear. Guys, in ear what you should study, like first again my like variant will be same from most to least. Most important to least important I'm going to explain. So very first will be, my suggestion will be like diseases. Study diseases thoroughly in detail. बढ़िया से पढ़ो, अच्छे से पढ़ो, disease से क्वेश्चन आने वाला है ना. डिजीज़ में क्या होगा, क्या इंपॉर्टेंट है, लाइक ऑटोस्क्लेरोसिस बहुत इंपॉर्टेंट है. एवरीथिंग, रीड एवरीथिंग अबाउट ऑटोस्क्लेरोसिस. देन मेनियस डिजीज़, लाइक गाइज लास्ट 2-3 टाइम्स दे आर आस्किंग क्वेश्चन फ्रॉम मेनियस डिजीज़. सो मेनियस डिजीज़ अच्छे से पढ़ना, जहाँ से भी नोट्स हो डिटेल में. उसके बाद आता है ओटाइटिस मीडिया. इन ओटाइटिस मीडिया यू हैव टू गो थ्रू इन डिटेल. लाइक देर आर 4 टाइप्स ऑफ ओटाइटिस मीडिया, like ASOM, CSOM, suppurative, then SOM suppurative, CSOM chronic otitis media. So these things, one more thing like TB of tubular otitis media. So you have to find differences between this, like in multiple perforation किस में दिखता है, single perforation किस में दिखता है, marginal किस में, these things like otitis media you have to study everything in detail. Now tumors, there are tumors, two tumors are mainly important in ear, jugular like glomus jugular and aqueous neuroma. Aqueous neuroma में से बहुत बार क्वेश्चन पूछा है, so definitely they are going to ask this time also, and in future exams also they are going to ask from aqueous neuroma. Now guys, there in ear there is a one more important topic, surgeries. Like there are, you have to differentiate between surgeries like laryngotomy, laryngostomy, laryngotomy, laryngoplasty, tympanoplasty. These things you have to study. Definitely going to like come question is will be there from there. Now guys, one more thing, there is examination, that is very important. From examination you have to read. They are asking question like last time when I जब मैं एग्ज़ाम दिया था दिसंबर में, they asked that time BERA. So BERA, OAE, both are important, autoacoustic emission or BERA, brain stem evoke response test. Then there is like tympanometry going to ask, and I think 6 or 7 exams are there, exams or test, whatever your calorie test, this fistula test, very important, fistula test is very important, and calorie test is also, like in calorie there is a mnemonic, which side lateralization and medialization, these things you have to study. So examination go through one. Then last but not least, facial palsy. You should go through facial palsy, all nerves which going in ear they are asking, like they are asking clinically, so for that you have to study facial palsy also. Now guys, the next topic also, like if you want you can go through anatomy in superficial. Nowadays they are not asking, but you have to go for overview for better understanding of diseases. Go through ear anatomy once. Now ear is completed, next is throat. Now in throat what you have studied guys, there is many topics. So again some going most important to least important. The most important is NPC. This is like nasopharyngeal carcinoma. Guys, trust me, one or two question will be from this NPC. Every year asking, so definitely this time also they are going to ask NPC. Study very first, if you are starting nose, start with NPC. This is my suggestion. Then the next will be vocal cord palsy. There are asking questions like vocal cord palsy, unilateral, bilateral, whatever they are asking, just go and study like vocal cord palsy. Now there is a Laryngo Malaysia. Guys, as you know, image base are coming from this topic, Laryngo Malaysia. Every times they are asking, repeating continuously. So for my suggestion will be not only image, study in detail like Laryngo Malaysia, causes, treatment, age distribution, in which age it is, this is like very important. Now there is a one more thing, epiglottitis and croup. Also they are asking every day, like in every exam, what appearance will be in epiglottitis, like two appearance are there, stipple and thumbprint appearance. So you have to go through these topiks in detail, because if they are repeating, you should also repeat. You should repeat more time, 5, 6. But whenever you are starting ENT, whenever you are starting through, start with NPC, then go to the like Laryngo Malaysia, then go to croup, acute, these things. Now guys, there is a question, image based, they are asking difference between polyps and vocal cord polyps and vocal cord nodules. So you have to differentiate, you have to know, पता होना चाहिए कि दोनों में डिफरेंस क्या है, कैसा दिखता है. Then guys, tonsils. Study tonsils like paired, which is paired tonsil, paired name and then location of tonsils, very important. Go through in detail tonsils. You are going to have questions like which tonsils appear first, which appear most last. So these things you have to study in detail. Then guys, one more topic is important in these things like glottitis. Then difference between supraglottis and infraglottis. Then supraglottis and subglottis. What appearance will be, what will be the shape in children, and बड़े में क्या shape दिखेगा, children में क्या shape दिखेगा. You have to know about these things. Then cartilage, कौन सा cartilage paired है, कौन सा unpaired है. last time also they are asking, so definitely in future they are going to ask. Cartilage ka pair, is it pair or unpaired? What is the name of, like they will give 2-3 paired cartilage and one will be in unpaired cartilage. They will ask all are the following are paired except one. So you have to know the detail in detail in these topics. Sorry. Now third will be, already I have completed ear, throat, then will be the nose. What question will be there from nose? Guys, obviously there will be image based from nose, like as you know, if you will open the previous year question, you will get images of nose, rhinophioma, woody nose, these things will be there in exam. So image based will be there. So start nose with rhinophioma. Obviously you can start all topic with anatomy, it's up to you. If you have better understanding in anatomy, direct start with disease, because question are coming from disease and clinical. So rhinophioma, there will be one question every year they are asking, so I'm hoping again they will ask, because these are important topic. Rhinophioma, sinusitis, then aspergilloma. गाइज एस्पार्जिलोसिस से रिलेटेड जो भी है पढ़ लो, पूरी बॉडी में कहीं भी एस्पार्जिलोसिस डिजीज कॉज कर रहा है सब पढ़ लो. सो एस्पार्जिलोमा इन नोज दे आर आस्किंग. देन गाइज एनाटोमी ऑफ, समटाइम दे आर आस्किंग एनाटोमी ऑफ नोज, समटाइम्स का वो पूछ ही रहे वो कंटिन्यूसली दे आर आस्किंग. लाइक वन थिंग वेरी इंपॉर्टेंट इज कैसलबैक्स प्लेक्सस, ऑल्सो कॉल्ड लिटेल्स एरिया. लाइक कौन कौन से आर्टरीज वहाँ पे आते हैं, कौन कौन से वेन्स वहाँ पे आते हैं, और कौन एपिस्टैक्सिस, जब उसकी एनाटॉमी पता होगी तभी पता होगा एपिस्टैक्सिस क्या है, एपिस्टैक्सिस का सोर्स क्या है, सब कुछ हर बार दे आर आस्किंग डिफरेंट थिंग फ्रॉम एपिस्टैक्सिस. लाइक लास्ट टू लास्ट टाइम दे आस्क ऑल आर्टरीज कम टू द लिटिल्स एरिया एक्सेप्ट, कौन से नहीं आते, एंटीरियर इथोमेडल पोस्टीरियर, तो एंटीरियर आता है, पोस्टीरियर इथोमेडल आर्टरी नहीं आता है. दिस थिंग्स यू हैव टू नो इन डिटेल. सो लिटिल्स एरिया. देन नोज ब्लीडिंग से रिलेटेड एवरीथिंग, like CSF, rhinorrhea, nose bleeding, because these things correlate with clinical, with other subjects. So you have to know clinical correlation. So for that matter, these things, little's area, nose bleeding, rhinorrhea, these things are important in nose. Then the next will be like epistaxis, already I complete. Sinusitis. Then triad. Guys, there is different triad in ENT, nose, like Orhan's, Orhan's, no, I can say there will be like Samster triad, and one more things, Young's syndrome. These things are related to medicine, so you have to study with these things. Then the tumor, like right in nose there are tumors, 2 or 3 tumors, you should know tumors they are asking. So not detail notes, tumor you should not study in detail, but you should go overview. Like there is neuroblastoma, Ringer's tumors, and Orhan's lines. Guys, there is a image based question or there is a clinical correlation. They will ask Orhan's lines. It start from here and go till here. So what is the clinical correlation with this? अगर ट्यूमर इस Orhan lines के ऊपर होता है तो उसका प्रोग्नोसिस बहुत बुरा होता है, नीचे होता है तो प्रोग्नोसिस अच्छा होता है. सो दिस थिंग्स, लास्ट टाइम दे आस्क व्हाट इज द सिग्निफिकेंस ऑफ Orhan's lines. So you have to, there were options, so you should know Orhan's lines from where it start and where it going to end. Then the what is the importance. So guys, these topics were important in ENT. I have explained with experience what already I have seen last 3 or I have gone through 2 or 3 questions previous years. Then what topic they are repeating and what you should go for, what will be the chances for next exams, like upcoming exam there will be going. So जो भी मैं बताया गया इस टॉपिक को अच्छे से पढ़ो, और अब ज़्यादा दिन नहीं है, पूरा ENT मत रटो, जो इम्पोर्टेंट टॉपिक है पहले उसको अंडरलाइन करो, जब रिवाइज करो उसी को पढ़ो. लाइक अगेन अगर ओवरऑल देखो, NPC, नेजोफेरिंजियल कार्सिनोमा, ओटाइटिस मीडिया, ट्यूबुलर ओटाइटिस मीडिया, देन अगर ENT में एपिस्टैक्सिस, थ्रोट में जो टॉन्सिल्स, कार्टिलेजेस, देन वोकल कॉर्ड पाल्सी, Laryngo Malaysia, these topics are very important. Continuously they are asking. So guys, study with this. Guys, simply work smart. Again I'm saying work smartly. Now there is less time, so revise more number of time and work smartly. जो अब मैं भी जो सारे सब्जेक्ट का लेके आने वाला हूँ, जो सब्जेक्ट का लाया हूँ, वट एवर वीडियोज़ आई हैव मेड, लाइक दिस आई थिंक सेकेंड वीडियोज़, कंटिन्यूसली इट विल बी कमिंग. सो वंस see the video and then start your study. It will help you because you start with important topic and go with least important. So that's going to help you in exam. Important topic is revise more number of time, then least important topic is study less number of time. So it's up to you how much you want to score. Guys, follow these things, you are going to score good marks, and all the very best guys. Study hard and hard. Thank you.